Okay, so imagine this. A new law that saves the government almost $1 trillion. Sounds pretty good, right? But what if that same law could also cause millions of people to lose their health insurance? Well, that's the giant puzzle at the center of a new Congressional Budget Office report on Medicaid. And today, we're going to break it down and see what's really going on. To really get your head around this law, you have to start with two headline numbers. And honestly, they seem to completely contradict each other. They're pulling in opposite directions, and they really set up the core conflict of this whole thing. Let's dig in. First up, this massive number, a projected reduction of almost $887 billion from the federal deficit over the next 10 years. I mean, to put that in perspective, that is a staggering amount of money. It's a huge, huge fiscal impact. But then on the flip side, you've got this number, 7.5 million. That's the CBO's projection for how many more people will be without health insurance by 2034. That's more than the entire population of the state of Arizona. So you can see it's a huge human impact. So you're probably asking, how is that even possible? How can one single law lead to such massive savings and such a huge jump in the number of uninsured people? Well, that's the big question we're here to answer. It all comes down to how this law just fundamentally rewrites the rules of the game for Medicaid. All right, so the first piece of this puzzle is all about the new roadblocks this law puts up. Roadblocks for people who are just trying to get and keep their health coverage. And this isn't about changing who qualifies for Medicaid. Not really. It's all about changing the process itself. You know, for a while there, the trend was to simplify the rules, to make it easier for people to sign up and renew their Medicaid. But this law, it basically slams on the brakes and throws the whole system in reverse. It blocks those newer, streamlined rules and brings back older and often way more complicated administrative procedures. And here's a perfect example of what I mean. For a whole bunch of adults on Medicaid, states used to check if they were still eligible once a year. Pretty standard. Now, states are going to have to do it every 6 months. For millions of people, that literally doubles the paperwork and doubles the chances that a notice gets missed or a form gets lost. But this is the real kicker. The CBO looked into why people would lose coverage because of these more frequent checks. And just look at this chart. They project that a full 70%, 70, will lose their coverage, not because they're no longer eligible, but simply because of procedural reasons. We're talking about getting tangled up in the paperwork, a missed letter, a confusing website, that kind of stuff. Okay, now for the second major piece of the puzzle, let's follow the money. Because this is all about how the new law changes the way states can actually pay for their share of Medicaid. And believe me, this has a massive ripple effect across the whole system. Now to get this, we got to talk about something called provider taxes. It sounds complicated, but think of it like this. A state will tax a hospital, for example. Then it uses that exact same tax money to help pay for its Medicaid program. It's a clever way for states to basically leverage their own money to pull in more matching funds from the federal government. But this new law really clams down on that whole system. It actually stops states from creating any new provider taxes, and it lowers the limits on the ones they already have. The bottom line is, it just makes it a lot harder for states to come up with the cash they need for their programs. And the law doesn't stop there. It also goes after another funding stream called state-directed payments. You can think of these as well, kind of like bonus payments that states can funnel to places like hospitals and nursing homes to help them cover the really high costs of caring for Medicaid patients. So what does the new law do? It basically turns down the tap on those bonus payments. By setting a new lower cap, it means less federal money is flowing into state Medicaid programs to support those really vital health care providers. But of all the changes we've talked about so far, there is one that has by far the most dramatic impact on, well, everything, both the budget and the number of uninsured people. And it's something called the Community Engagement Mandate. So what does this actually mean for people? Well, it means if you're an able-bodied adult without any young kids, you now have to prove that you're working or in job training or volunteering for at least 80 hours every single month, all just to keep your health insurance. And according to the CBO, the impact of this one change is just enormous. We're talking about 5.3 million people losing coverage. That's more than 2/3 of that total 7.5 million number we saw at the beginning, just from this one provision. And once again, we see that same theme pop up. It's not just about people failing to meet the 80-hour rule. The CBO found that almost half of those 5.3 million people, that's 2.8 million folks, are projected to lose their coverage just because they get caught up in the red tape of trying to prove they're doing what they're supposed to be doing. So let's just zoom out for a second and look at the whole picture. We've seen how this law puts up new hurdles, cuts back on state funding, and adds this huge new work requirement. But as the CBO itself is really quick to point out, what actually happens next is still pretty uncertain. This table really just lays it all out. You can see exactly which parts of the law are doing what, both on the savings side and the coverage loss side, and it is crystal clear that that community engagement mandate is the real heavyweight here, driving the biggest impacts on both sides of the ledger. And it's so important to remember where these numbers are coming from. This isn't some political group with an axe to grind. The CBO is basically the neutral, nonpartisan scorekeeper for Congress. Their only job is to analyze the data and call it like they see it. But the CBO is also really honest about what it can't know for sure. I mean, think of it like trying to predict the exact weather a decade from now. They can give us their best expert forecast based on all the data, but they admit that these numbers are subject to, quote, significant uncertainty. There are just too many moving parts, and these are the really big what-ifs. How exactly will states choose to enforce all these new rules? Will hospitals figure out new ways to handle funding changes? And how will real people, day to day, actually manage to navigate these new complex systems? The answers could change everything. So in the end, that leaves us with the central question. When the dust settles on this law, what's its story going to be? Will it be remembered for reining in government spending? Or will it be remembered for its human impact? The CBO has given us the projections, but only time is going to give us the answer.